I'm Richard Dean, and I'm really honored to be here tonight. And I think I'm speaking for the patients here at Johns Hopkins, the patients that you serve, and the patients that you have served for 125 years. Just imagine all of those patients assembled in one place, maybe Oriole Park or M&T Bank Stadium, and that wouldn't even hold all of those people. Think about the lives that you've touched, the lives that you've saved, the good that you've done. And I know that those of you that are here know that that's why you're doing this work. And give yourself a round of applause for those patients who can't be here but would love to recognize you. And two of those patients were my family members, my wife Janet and my daughter Samara, treated in Weinberg 4B, the kind of care that I could never really thank you enough for. And just an honor for me to be here to speak to you and about your work here. I was impressed at an early time about the founders of Johns Hopkins, and we talked about Johns Hopkins and his dedication to creating a place where people could get medical care in spite of their race, their financial position, and their sex. And also Mary Elizabeth Garrett, who was instrumental in founding the university medical school, dictating that it would become a postgraduate medical institution and be equally available to women. Now, I also note that those people were not medical experts and yet appreciated the importance of the medical institution that Hopkins was to be. And their vision, I think, have created, and their foundation created the kind of place that Hopkins has become, a great visionary leaders. I'm honored to serve in the Patient and Family Advisory Committee. And this committee has only been in place for 3 years, so it's all new work. And yet in those 3 years, I've seen a tremendous growth in the activity of that committee and its contribution to what's happening here at Hopkins. Initially, these were simply modest efforts, but they have grown to be palpable, real changes here at Johns Hopkins. The voice of the patient is really now being heard, I believe, here in this institution. When we have meetings, which are right across the hall here, we have staff members that come and we're engaged in really dynamic, interesting, vital topics that are key to healthcare here at Hopkins. Members of our committee, patients and family advocates, are being asked to participate in committees all around the hospital to provide that voice that will help to make medicine better. Patient-centered care is now a pillar of the strategic plan for this hospital moving forward. There are changes to the culture. We can feel that. Just having been here over the last 5 years, I can feel the changes that are occurring. And I've been asked here to speak tonight at this forum, which probably wouldn't have happened 5 years ago. Patient councils are being established at departments and units, and not because leadership is requesting it or our council is pushing it, but the staff here is being drawn to that. In the emergency department and the Kimmel Cancer Center, they are creating their own family advisory councils and are drawing people in to help make this move forward. Our vision, like yours, is to make better medicine here at Hopkins. And patient-centered care is not just happy patients. It's not just better price-Gini scores. It's about better care. It's about better medicine. It's about better outcomes. And better use of resources. So Johns Hopkins and Mary Elizabeth Garrett were just a couple of amateurs a century or so ago who had a vision about medicine here at Hopkins. And moving forward, I envision Hopkins embracing patients and creating a community of care, a dedication to excellence, and making medicine better. Thank you.